Most people look at their face in the mirror every morning, but almost no one looks at their tongue. And that's surprising, because your tongue is one of the few parts of your body that can quietly reveal what's happening inside you, long before symptoms become obvious. Not pain, not illness, not weakness, just small changes. A slight shift in color, a different texture, a feeling that something is not quite the same as it used to be. And most people ignore it. They assume it's nothing. Temporary, harmless, not worth paying attention to. But here's what most people don't realize. The tongue is closely connected to your circulation, your immune system, your digestive health, even your nervous system. When something inside the body begins to change, the tongue often reflects it first. Not loudly, not dramatically, but quietly, consistently, and over time. A patient once told me he had noticed a strange coating on his tongue for weeks. It didn't hurt. It didn't interfere with eating, so he ignored it. By the time he decided to get it checked, it was no longer a small issue. And that's the pattern I've seen again and again. The body gives signals, but those signals are often subtle. And when they are subtle, they are easy to dismiss. This is not about creating fear. It's about awareness. Because when you understand what your body is showing you, you don't have to wait for something serious to happen before you take action. In this video, I'm going to walk you through some of the most important signs your tongue may be showing you, what they can mean, and when you should pay closer attention. Some of these signs are completely harmless, but others are not. And the difference between the two is something most people are never clearly told. My name is Darius Coleman, and if you find this kind of clear, honest medical guidance helpful, take a moment to like this video and subscribe to the channel. Because the more you understand your body, the more control you have over your health. What a healthy tongue should look like. Before we talk about warning signs, we need to begin with something much simpler, something most people never stop to consider. What does a healthy tongue actually look like? Because without understanding what is normal, it becomes very difficult to recognize when something has changed. And most changes don't happen suddenly. They happen quietly, gradually, over time. A healthy tongue is usually a soft, natural shade of pink. Not bright red, not pale, not covered in thick layers or unusual patches. Just a balanced, even tone that reflects stable blood flow and healthy tissue beneath the surface. When you look closely, the surface of the tongue is not completely smooth. It has a slightly textured appearance. These tiny structures are called papillae. They may seem small, almost insignificant, but they serve an important function. They help you sense taste, texture, and temperature. They are part of a much larger system, one that connects your mouth to your nervous system, your digestion, and your overall health. In a healthy state, these papillae are evenly distributed across the tongue. They give it a soft, slightly rough texture, not overly smooth, and not overly raised. Now here's something many people don't realize. It is completely normal for the tongue to have a very thin coating. This coating is made up of bacteria, dead cells, and natural debris that builds up throughout the day. In most cases, it is light, almost unnoticeable, and it can be easily reduced with regular brushing or simply by staying well hydrated. But this is where awareness begins, because small changes in this coating can sometimes reflect larger changes inside the body. If the coating becomes thicker, darker, or uneven, it may no longer be just a surface issue. It may be a reflection of something deeper. And this is where most people make a mistake. They assume that because the tongue doesn't hurt, it doesn't matter. No pain means no problem. But the body does not always communicate through pain. In many cases, it communicates through appearance, through subtle shifts, through small differences, through patterns that repeat over time. The tongue is one of the few places where these internal changes become visible, and yet it is one of the most overlooked. Let me explain why that matters. The tongue is directly influenced by several systems in the body. Circulation plays a major role. The color of your tongue is closely linked to how well blood is flowing through its tissues. If circulation changes, even slightly, the color can begin to shift, sometimes only a little, but enough to notice if you are paying attention. Hydration is another important factor. When your body is properly hydrated, the tongue appears moist and balanced. But when hydration drops, the surface can become dry, sometimes slightly rough, even cracked in more noticeable cases. Nutrition also has a direct impact. The body depends on essential vitamins and minerals to maintain healthy tissue. When those nutrients are lacking, the tongue may begin to lose its normal texture or change in appearance. In some cases, it may become smoother than usual. In others, more sensitive. And then there is the immune system. Your mouth is constantly exposed to bacteria. A healthy immune system keeps this environment balanced. But when that balance is disrupted, changes can begin to appear. Not dramatic changes, subtle ones, the kind that are easy to ignore. And that's the problem. Because the tongue does not suddenly change overnight. It shifts slowly, quietly, in ways that are easy to miss unless you know what you're looking for. Most people don't. They see their tongue every day, but they don't really observe it. They don't compare. They don't notice patterns until something becomes obvious. And by then, the signal has often been there for weeks, sometimes even longer. This is not about turning every small change into a concern. It's about understanding your baseline. Because once you understand what is normal for your body, you begin to notice what is not. And that awareness is where early detection begins. Because the earlier you recognize a change, the easier it is to understand it and respond to it. In the next part, we're going to look at one of the most important signals your tongue can show you, a change in color, and why that change is often the first quiet indication that something inside the body may not be functioning the way it should. Changes in color, what your tongue may be telling you. Color is often the first thing that changes, long before anything else becomes noticeable. Not pain, not discomfort, not weakness, just a subtle shift, a tone that seems slightly different, a shade that doesn't quite match what you're used to seeing. And because it's subtle, most people ignore it. They assume it's temporary, something they ate, something that will correct itself with time. But when it comes to the tongue, color is rarely random. It is often one of the earliest signals the body gives when something inside begins to change. Let's start with a pale tongue. If your tongue appears lighter than usual, almost washed out in color, it may be a sign that your body is not producing enough healthy red blood cells. This is commonly seen in certain types of anemia. Now, this doesn't happen overnight. It develops slowly. And because it develops gradually, many people don't notice it at first. They may feel slightly more tired, a little more fatigued than usual. But they adjust. They assume it's age or lack of sleep or just a busy week. The tongue, however, reflects what's happening internally because it depends on oxygen-rich blood. And when that oxygen supply is reduced, the color often fades with it. On the other side of the spectrum, a tongue that appears unusually red, sometimes even glossy, can indicate something very different. This type of change may be linked to irritation, inflammation, or a lack of certain essential nutrients, particularly vitamins that are responsible for maintaining healthy tissue. When those nutrients are low, the surface of the tongue may begin to change. It can lose its normal texture, becoming smoother, almost polished in appearance. Some people also notice increased sensitivity. Foods that once felt normal may now cause a mild burning or discomfort. Not severe, but enough to feel different. And again, often ignored. Then there is the white coating. A thin, light layer on the tongue is completely normal. But when that coating becomes thick, persistent, or difficult to remove, it may be more than just a surface issue. It can sometimes indicate an imbalance in the natural environment of the mouth. In some cases, this may be related to bacterial or fungal overgrowth. In others, it may reflect dryness or a weakened immune response. And while many of these causes are not dangerous, they are not meaningless either, because they indicate that something is out of balance. There are also cases where the tongue may appear darker than usual. Not dramatically, but enough to notice if you're paying attention. Sometimes the color appears uneven, sometimes patchy. This can occur when the normal renewal process of the tongue slows down. Old cells begin to accumulate, rather than being replaced efficiently. Over time, this buildup can change the surface color. Again, not always serious, but not something to completely dismiss if it continues. Here's the key point. Color changes rarely happen without a reason. They are not random variations. They are responses to what is happening inside your body. Changes in circulation, shifts in hydration, variations in nutrient levels, activity within the immune system. All of these factors influence the appearance of the tongue, and the tongue reflects them, quietly, without urgency, without pain, which is exactly why they are often overlooked. Because when something doesn't hurt, it doesn't feel important. But early signals rarely come with pain. They appear first, they speak softly, and they give you time. The difference is whether you notice them or ignore them. This is not about assuming that every change is serious. It's about recognizing patterns. If a color change appears briefly and then returns to normal, it may not require concern. But if it remains, if it becomes more noticeable, If it is accompanied by other subtle changes, then it becomes something worth paying attention to, because the body is not being random. It is communicating. And the earlier you begin to observe those signals, the clearer they become. There is also something else worth considering. Many of these changes are reversible when the underlying cause is addressed early. But when ignored, they can progress, not always into something serious, but often into something more difficult to manage later. And that is where awareness becomes powerful. Because awareness does not create fear, it creates control. In the next part, we are going to look beyond color. Because sometimes the most important signals are not what you see, but what you feel. Changes in texture, in sensitivity, in the surface of the tongue itself. And why those changes can sometimes reveal even more than color alone. Texture and surface changes you should not ignore. While color changes are often the first thing people notice, texture is usually the first thing the body changes, not always visible at first glance, but felt. A difference in how the tongue moves, how it feels against the roof of your mouth, how it reacts to food. And these changes are often more important than they appear, because texture reflects the condition of the tissue itself, not just what you see on the surface, but what is happening underneath. Let's begin with something subtle, a tongue that suddenly feels smoother than usual. At first, this may seem like a minor difference, almost unnoticeable. But in many cases, it means something has changed in the structure of the papillae, those small projections that give the tongue its natural texture. When these begin to flatten or disappear, the tongue can take on a glossy, almost polished appearance. And while it may not cause immediate discomfort, it is not random. It is often associated with changes in nutrition, particularly deficiencies that affect tissue health. And because these deficiencies develop gradually, the change in texture often follows the same pattern. Slow, quiet, easy to overlook. Then there is the opposite, a tongue that feels rougher than usual. Not painful, but uneven, sometimes described as a dry or coated feeling. This can occur when the natural balance of the mouth begins to shift, when hydration levels drop, when saliva production decreases, or when the surface is not renewing as efficiently as it should. The tongue depends on constant renewal. Old cells shed, new ones replace them. But when that process slows down, the surface can begin to feel heavier, thicker, less responsive. And over time, this can affect more than just comfort. It can begin to affect taste. Another change people sometimes notice is the appearance of small grooves or cracks. These are often harmless, especially if they have been present for many years. Some people are simply born with them. But when these lines deepen or appear suddenly, it may be a sign that the tissue is becoming less resilient, less able to maintain its normal structure. In some cases, this can be linked to dehydration. In others, to nutritional imbalance, and sometimes to chronic irritation. There are also situations where the tongue becomes more sensitive. Foods that once felt completely normal suddenly begin to cause discomfort. Spicy foods, acidic foods, even hot drinks. What was once routine becomes noticeable. And this sensitivity is not without reason. It often indicates that the protective surface of the tongue has been affected, that the outer layer, which normally shields the underlying tissue, is no longer functioning as effectively. And when that layer is compromised, the tongue becomes more reactive, more vulnerable. Then there are sores, small ulcers that appear, often unexpectedly. Most of these are temporary. They heal within a short period of time. And in many cases, they are triggered by minor irritation, stress, or temporary changes in the body. But the important distinction is time. If something appears and does not heal within a couple of weeks, it should not be ignored. Not because it is necessarily serious, but because persistence is not typical. And persistence is a signal. The body does not maintain abnormal patterns without a reason. There is always a cause, sometimes simple, sometimes more complex, but always worth understanding. There is also a condition where the tongue develops a thickened surface, sometimes even appearing coated or slightly elongated in texture. This can create a feeling that something is stuck on the tongue, that brushing does not fully remove it. Again, not always dangerous, but often linked to changes in the natural cleaning process of the mouth. Reduce saliva. What you should do. If you notice these signs, by this point, you've seen something most people never take the time to understand. That the tongue is not just a part of the body. It is a reflection, a surface where small internal changes can quietly appear, long before they become something more serious. And that realization can feel uncomfortable, because once you begin to notice these signs, it becomes harder to ignore them. But this is where clarity matters. Because the goal is not fear, the goal is control. So the question becomes, what should you actually do if you begin to notice these changes? The first step is simple: observation. Not assumption, not panic, just awareness. If you see a change in color, texture, or sensation, take a moment to notice it. How long has it been there? Did it appear suddenly or gradually? Is it improving or staying the same? Because temporary changes are common. They can be caused by something as simple as dehydration, a change in diet, or even minor irritation. And in many cases, they resolve on their own. But persistent changes are different. They follow a pattern. They remain, even when conditions around them change. And that persistence is what makes them important. The second step is basic care. Simple things that support the body's natural balance. Maintain proper hydration. A well-hydrated body supports healthy tissue, including the tongue. Pay attention to nutrition. Ensure your body is receiving the essential nutrients it needs to maintain normal function. Practice consistent oral hygiene, not aggressively, not excessively, but consistently, because the environment of the mouth plays a direct role in how the tongue appears. These steps may seem small, but they create stability, and stability allows the body to correct minor imbalances on its own. But here is where many people hesitate. If the change does not go away, if it becomes more noticeable, or if it is accompanied by other symptoms, the next step is not to wait longer. It is to seek clarity, to speak with a healthcare professional, not because something is definitely wrong, but because understanding is always better than uncertainty. Early conversations are simple. They are calm. They are controlled. Late conversations are often not. And this is something I have seen many times. People notice small changes. They ignore them. They adjust to them until those changes become impossible to ignore. And by then, the situation is no longer simple. But it doesn't have to reach that point, because most signals, when addressed early, are manageable, sometimes even completely reversible. And that is the difference awareness creates. It does not change the body. It changes how you respond to it. There is also something else to understand. Not every change means something serious. In fact, most changes do not. The body is constantly adjusting, adapting, responding to daily conditions, and small variations are part of that process. But the key is not to assume. The key is to observe patterns, to notice consistency, to recognize when something is no longer temporary. Because the body communicates in patterns, not in isolated moments. And when you begin to understand those patterns, you begin to understand your body in a different way, a more informed way, a more controlled way. This is not about becoming overly concerned. It is about becoming aware. Because awareness removes uncertainty. And when uncertainty is removed, decisions become clearer, actions become simpler, and outcomes often become better. So if you notice something, do not ignore it. Do not overreact to it. Observe it. Support your body. And if needed, seek clarity. Because the goal is not to wait for something to go wrong. The goal is to recognize when something is beginning to change before it becomes something more. And that is the difference between reacting to health problems and managing them before they fully develop. If this helped you see your body differently, even in a small way, consider sharing it with someone who might need to hear it. Because sometimes the smallest signal is the one that matters the most. Take care of yourself. And more importantly, start paying attention. Your body has been speaking to you all along. Changes in oral bacteria, lifestyle habits, all of these can contribute. And here's the key point. Texture changes are rarely isolated. They often appear alongside other subtle signs. Changes in color, changes in sensation, changes in comfort. And when multiple small changes begin to appear together, that's when the signal becomes clearer, not louder, but more consistent. The body is not trying to alarm you. It is trying to inform you, quietly, through patterns, through repetition. And the earlier you begin to notice these patterns, the easier it becomes to understand what they may represent. Because the goal is not to react to symptoms after they become severe. The goal is to recognize signals while they are still small, while they are still manageable. In the next part, we're going to bring everything together. Not just what these signs mean, but what you should actually do if you begin to notice them. How to respond without panic, but with clarity and control. Because understanding the signal is only the first step. Knowing how to act on it is what truly makes the difference.